My team and I work with the community and the local health services to monitor constantly and to respond to any case of paralysis. If we think we found a polio case, we quickly send a sample to a lab for confirmation so we can stop a potential outbreak.
We test samples from cases of paralysis to see if there's any polio present. We also test samples from the environment to get a complete picture of where polio might be circulating. These laboratory data inform public health actions to respond quickly to outbreaks and protect children from polio.
Before we start any campaign, we must engage with community leaders. I visit household. It is important to hear their concern and clarify their doubt and motivate them to vaccinate their children against polio.
पोलियो के कतरे पिलाने की मुहिम के दौरान मैं अपनी टीम के साथ घर घर चलती हूँ, ख़ानदानों से मिलती हूँ और उनके बच्चों को पोलियो के कतरे पिलाती हूँ। पोलियो को कम्युनिटी में फैलने से रोकने और बच्चों को मजबूत और सेहतमंद बनने में मदद देने का वाहिद तरीका पोलियो वैक्सीनेशन है।
With your support,
your help,
your support,
आपके ताउन से हम पोलियो का खात्मा कर सकते हैं।
My name is Dr. Sophia Yunus. My title is Director General for Federal Directorate of Immunization. And this is the lead of National Immunization Program.
Barrier has been removed, the gender barrier has been removed.
To be able to be here as a woman and to be able to meet with the frontline female health workers, to say two simple words to them, thank you.
Thank you on behalf of our PEI program, I thank you.
frontline workers, amazing team.
My name is Zainul Abidin Khan. I'm here working as a national team leader for WHO polio program.
Today we're going to talk about the gender strategy and the importance of this to the polio program. Dr. Sophia, let me start with you first. You've been in the immunization world for a number of years. Is this changing the way that we're able to approach polio?
We found that females were reluctant to be vaccinated by male vaccinators. In every strategy we make and in every activity that we conduct, we ensure that females are part of it. We are enlisting people for promotion, recruiting through headhunting. In immunization program, it started in 1974, and since then the national immunization head was never a female, but my presence speaks it all.
Dr. Zain, as one of our partners, what does it mean from WHO's perspective?
As we follow the GPI strategy and WHO policy to always empower the women leadership. So I have the opportunity as a team leader of WHO. I have a huge team here and I have the opportunity to actually exercise this policy.
So you're showcasing leadership at the organizational level. We now see leadership coming up from the grassroots. And what do you think the role of female frontline health workers means to our eradication efforts?
As we are heading towards eradication, there are still communities that require female frontline workers. We are trying to get more of them because most of the female workers, when they are going into the community, they need to be secure. So recruiting couples so that the wife and husband or brother and sister, they go together. So for such conservative societies where we struggle both in terms of female vaccinators or the social mobilizers.
Dr. Zain, this is about changing culture, isn't it? And certainly culture in this nation. It's not easy, but are we taking enough steps so far?
Yes, you rightly said it's not easy. And this culture of this country is not easy to change overnight. But this polio program gave us some opportunities. And in this culture, the men are not allowed to go inside houses. So this is giving us opportunity to introduce female more in the team.
The EPI, the expanded vaccination program, and a gender balance is going to benefit from this because there's so many other immunizations that we need to be able to reach. How do you see that affecting what your work is, what's happening in your work?
We recruited a number of vaccinators, and we have asked the province to please let us know if you need additional workforce. UNICEF provided us with an opportunity to recruit 250 vaccinators, and out of that, almost all were for female vaccination.
Last thing I want to focus on right now is certainly part of the partnership, but what role do you see Rotary playing in the eventual victory as we cross the finish line in eradicating this disease?
So first of all, Rotary is part of immunization technical advisory group, which is called an NICC. Dr. Aziz Maiman is a part of that. The level of advocacy and the level of penetration into the top government leadership that Rotary brings in, every community level, and the positive energy they bring into international and polio. So Dr. Zan.
I've been working for polio since year 2000, and I worked in several countries, including India, Nigeria. Personally, I believe that we are trying to fulfill the dream of Rotarians to see this world without polio. The support of Rotarians, not only here, everywhere I saw, is more than a partnership. It's generous, and they never say no.
Thank you both for your time, and thank you for your leadership and everything that you bring to this effort. It is immensely appreciated, and my sincere gratitude to you both.
Thank you, and thank you for your time, and we really appreciate Rotary International's contribution to polio eradication initiative of Pakistan. Thank you.
Thank you.
There are 678,290,000-ish children under 5 around the world. But what's so important about being 5? A lot, it turns out. Children who survive to age 5 are twice as likely to reach adulthood. That's why vaccines for young children matter so much. In the last 40 years, global public health infrastructure has reached children here, and even here. Impressive, right? But 12.5 million children in the world are still totally unvaccinated. They're called zero-dose children. Some of these kids are hard to reach because they're living in conflict zones or remote villages. But some aren't that far away, living in dense low-income urban centres. Essentially, they could be anywhere. Can we really find them? Absolutely. India proved it could be done. In 2009, nearly a third of Indian children under 2 years old were zero-dose children. That year alone, there were 741 reported cases of polio, more than any other country in the world. But with just 1 year of vaccination campaigns that included special strategies to reach zero-dose children, they reduced that number to 42 cases. But how? Well, in some places, vaccinators look for families at bus and train stations. Others use motorbikes or trekked by foot to find children in the most remote regions. And to tackle 107 city blocks identified as high risk, vaccinators travelled house to house, delivering immunisations for polio and other preventable diseases. Doing this required 4 million vaccine carriers, 5 million vaccinators, 344 million children vaccinated, and 450 million doses of polio vaccine. See? It can be done, and the results are worth it. Let's make sure all children grow up healthy and vaccinated against preventable diseases, and ensure that zero-dose children are a thing of the past.
For the last 30 years, I've been working within the Global Polio Eradication Initiative, particularly in close partnership with Rotary International, in one of the world's largest public health programs, that is to eradicate polio. In Pakistan, as of 13th September, 18 children have been detected to be paralyzed by wild polio virus in a part of southern Khyber Pakhtunkhwa. And this compares with only one case reported in Pakistan in 2021. And this outbreak actually started after a gap of 14 months of no cases of wild polio virus detected in Pakistan. In Afghanistan, as of 13th September, 2 cases of wild polio virus have been detected compared with 4 cases last year in 2021. The large outbreak of vaccine variant polio virus that affected both countries appears to have stopped now. The last case was detected in July of 2021. The detection of children paralyzed by wild polio virus reported into Malawi and in Mozambique, and the recent detection of vaccine variant viruses in New York, in London, and in Israel again remind us that as long as polio virus survives anywhere, it remains a threat to children and unvaccinated persons everywhere.
Non-wild polio variants are rare forms of the polio virus that occur if the weakened strain of the polio virus contained in the oral polio vaccine circulates among under-immunized populations for a prolonged period of time. If enough children are not immunized against polio, the weakened virus can pass in the community and over time genetically revert to a form that can cause paralysis. The polio virus knows no borders. We know this well in Africa, where non-wild variants outbreaks that started in one country have quickly spread to neighboring countries, causing multiple outbreaks. Last year, the Global Polio Eradication Initiative launched an innovative tool, the novel oral polio vaccine type 2. This new vaccine is a genetically modified version of the existing monovalent oral polio vaccine type 2 that can potentially stop outbreaks of known wild polio variants. Close to 500 million doses of this new polio vaccine have been delivered in over 23 countries. With new tools and continued commitment of all stakeholders, we are confident that together we can deliver on the promise of a polio-free world, a world where no child will be paralyzed by polio ever again.
On the road to eradication and containment, surveillance will continue to play a critical role in the certification process, ensuring that poliovirus transmission has been interrupted and the hard-earned win of a polio-free world will be maintained post-certification. The Global Polio Eradication Initiative, or GPEI, relies on a highly sensitive surveillance system to determine where the poliovirus is and is not circulating, especially as we experience fewer cases of polio in fewer geographies. This global system consists of field activities to detect cases of new onset limpness or paralysis with the collection of stool specimens from patients and the collection of sewage samples known as environmental surveillance. Samples are sent to a network of 145 laboratories where technicians are trained to test and analyze polioviruses. Today, there's an increasing number of wastewater sampling sites to pinpoint where the poliovirus may be circulating, even silently, when paralytic cases are not identified. This system is how the polio program identified the recent importation of wild poliovirus into Malawi and Mozambique from Pakistan, and how we've been able to respond to outbreaks of the variant poliovirus type 2 occurring mainly in Africa, and how poliovirus was detected in Israel, London, and New York.
20 million children are walking today who would have otherwise been paralyzed if it wasn't for the global polio eradication. And this gives us 20 million reasons to go on until we succeed. So on this World Polio Day, I want to appreciate and thank all of our polio health workers, particularly those who are working in extremely difficult and often insecure conditions at the front lines. I also want to thank all of our partners, particularly Rotary International, for their support at multiple levels, from financing to advocacy for on-the-ground efforts. Without Rotarians, we could not succeed in eradicating polio.
Every year, thousands of Rotary clubs around the world are taking action in the fight for a polio-free world by hosting events for World Polio Day.
In 2022, two Tasmanian Rotarians, Phil and Joyce Ogden, rode their tandem bicycle across the desolate Nullarbor Plain. A gruelling 5-week journey earned $35,000 on the Raise for Rotary page.
I just completed a Trans-Sahara motorbike adventure from London to Lagos to raise awareness and raise funds to the cause of ending polio in the world. To commemorate the 2022 World Polio Day, my club will be organizing 50 motorbike riders that will ride 100 kilometers across the streets of Lagos to raise awareness and raise funds for the foundation works. We have to end polio in the world.
2750地区東京三鷹ロータリークラブ所属、私宮崎陽一郎は10月1日に北海道宗谷岬を出発し、2750キロを24日間で走破するというエンドポリオサイクルチャレンジを行います。
Pumpkins for Polio was a project run in District 9980 during the Rotary year 2021-22. Our club signed up and grew Atlantic Giant Pumpkins. The biggest success was the increase in our fundraising. We managed to double our district polio giving total, and well done to all the Rotarians of District 9980.
We're holding a coloring contest through our local library using the coloring sheets that you can get on the Brand Center on the RI website. We'll have 3 winners. Each winner will receive a plush teddy bear wearing the End Polio Now sweater.
The train ride to end polio entails us covering how many stations, Dave?
181 stations in the Sydney metropolitan area.
And what we're doing is asking Rotarians, general public and clubs to sponsor us. We aim to raise $200,000 on World Polio Day.
O Rotary Clube de Belém organizou uma ação de saúde, esporte e lazer. Convidamos os pais a trazerem suas crianças para serem vacinadas. Neste dia, ajudamos a imunizar parte das mais de 3.500 crianças que foram vacinadas em Belém.
Our club has launched One Step Closer, a walk to end polio now. Club members are walking more than 300 miles from Florence to Rome to raise money and awareness for Polio Plus and the Rotary Foundation. From New Zealand to New York, our club members are committed to walking and raising $75,000. With every participant, every step, we are one step closer to our goal to end polio now.
Thank you to all Rotary members and supporters for your tireless efforts in making a global impact to end polio now.
World Polio Day this year feels a little different than it has in the recent past. For more than 30 years, we've been in this fight, and we know what is at stake. We know all about what's been accomplished. 3 billion children immunized, every country in the world but 2 declared wild polio free, case numbers way down. But the world today is facing multiple pandemics and vaccine hesitancy is on the rise. Recent polio outbreaks in Malawi and Mozambique, plus detection of polio virus in Israel, the United Kingdom, and the United States prove that if polio exists anywhere, it threatens children everywhere. The good news is that, working together with our incredible global health partners, we have a strategy in place that is working, and we will succeed in eradicating polio forever. Let's stand together like never before. Let's remove every impediment to conquer polio right here and now. And let's meet our target of $50 million to earn the full 2-to-1 match from the Bill and Melinda Gates Foundation. That is a deal too good to pass up. You've taken us this far, and you will get us over the finish line and take us to victory. Together, we will make this happen. Thank you again for standing strong. The children of the world are counting on all of us.